His Excellency Professor Ping, WHO Goodwill Ambassador for Tuberculosis and HIV and AIDS, Dr. Tedros, WHO Director General, Dr. Teresa Casava, Assistant Director General, UHC, Communicable and Non-Communicable Diseases, Ministers of Health from WHO member states participating in this event, representatives of the global partners from USAID, Global Fund, Stop TB Partnership, UNITAID, Bill and Melinda Gates Foundation, representatives of various civil society organizations, TB survivors present, members of the press, distinguished guests, ladies and gentlemen. Firstly, I want to express our solidarity to my counterpart, the Minister of Health for Malawi, for the lives lost and the significant damage caused to people's homes and livelihoods by the heavy rains and subsequent flooding occasioned by Cyclone Freddy. It is a great honor for Zambia to have been invited to participate in this year's global commemoration of the World TB Day. The event is being held under the theme, Yes, We Can End TB. As a representative of Zambia, I'm proud to say that we firmly believe that we can end TB, and indeed we shall. However, Zambia is one of the 30 countries worldwide that has a high burden of TB and TB HIV. In our country, Zambia, TB remains a major cause of ill health and one of the top 10 causes of death, especially among people living with HIV. Shockingly, TB alone accounts for at least 50% of the deaths among people living with HIV in Zambia. According to the World Health Organization, the TB incidence in Zambia was estimated to be at 307 per 100,000 population in 2022, which is a drop from 391 per 100,000 population in 2015. This is a positive development, but we still have a long way to go in our fight against TB. Distinguished ladies and gentlemen, over the past 5 years, Zambia has intensified its efforts in the fight against TB. We have been innovating and implementing new strategies to accelerate our TB response and maintain our health services, despite the challenges posed by the COVID-19 pandemic. We have been proactive in adopting new recommendations from the World Health Organization to transform our approach to TB. For example, we have expanded our TB diagnostic network, ensuring rapid diagnostic services like Gene Expert, which are available now throughout the country. And we have introduced a tool we are calling TrueNAT in health facilities without electricity, that is improving access to TB diagnostic services in the rural areas. Under the leadership of His Excellency the Republican President of Zambia, Mr. Hakainde Hichilema, Zambia is committed to achieving the global goal of ending TB by 2030. To achieve this goal, the government recruited and deployed over 12,000 healthcare workers in various health facilities across the country in 2022. Additionally, the government has increased funding for the health sector and TB services. Ladies and gentlemen, Zambia has made remarkable progress in the fight against TB through a multi-sectorial approach, innovative strategies, and investments in TB services. I want to share some of our significant achievements. Firstly, we have achieved a 22% reduction in TB incidence compared to the 2015 baseline, making Zambia one of the few countries to achieve the 2020 Global End TB Strategy milestone. Additionally, TB-related deaths have decreased by 65% in 2021 compared to 2015, which is another significant achievement in reaching the Global End TB Strategy milestone for 2020. Moreover, we have increased TB treatment coverage from 58% in 2018 to 85% in 2021. The treatment success rate of drug-sensitive TB has been sustained at over 90%, and over 90% people living with HIV have received life-saving TB preventive treatment towards reaching saturation. We have also achieved the United Nations high-level meeting target in various indicators, including TB diagnosis and treatment for drug-sensitive TB, TB diagnosis and treatment of children, and TB preventive treatment in people living with HIV. In addition, since 2020, we have implemented weekly TB surveillance and a corresponding weekly TB situation room, becoming the first country in the African region to adopt this innovation. We are actively implementing a multi-sectorial accountability framework for TB, and the guiding document of this is in its final stage. Lastly, we have completed the first ever out-of-pocket expenditure study, which has provided baseline information on the catastrophic costs families with TB face in accessing TB services. With these achievements, we are making significant strides towards ending TB by 2030. Distinguished ladies and gentlemen, I would like to extend my congratulations to all my colleagues, fellow ministers of health from the WHO member states for their outstanding work and achievements in the TB response. I'm also grateful to the WHO, particularly the Global TB Program, for their groundbreaking shift in guiding the global TB response. We appreciate the various innovative recommendations WHO has made, including a shorter treatment and patient-friendly regime for children, adolescents, and patients with drug-resistant TB and TB preventive treatment. I'm thrilled to announce that Zambia has already adopted these recommendations. Furthermore, I want to express my gratitude to the World Health Organization for selecting Zambia to host the regional consultation on the management of TB in children and adolescents. As I had the pleasure of opening the meeting on September the 27th, 2022, it has paved the way for revitalizing efforts in the African region to reach and treat every child or adolescent who has TB. Ladies and gentlemen, in conclusion, I'd like to express my deepest appreciation and profound gratitude to the WHO and all our partners for your unwavering support to the people of Zambia in this noble journey of ending TB. I want to assure you that Zambia remains committed to supporting the global initiatives towards ending TB. Therefore, we fully support the global call to intensify efforts towards ending TB. We will also provide our support during the upcoming United Nations high-level meeting on TB. I wish you all God's blessings on this crusade of ending TB, and as we commemorate World TB Day. Thank you.